My name is Kelsey Buchanan, and I'm a senior nursing student at the University of Pittsburgh School of Nursing. Today, I'd like to talk to you a little bit about a topic that's very important to me. As a senior nursing student, it's time for me to start thinking about what I want to actually do when I graduate. For so many years, people have asked me, do you know what you're going to do when you graduate? I'm sure we've all gotten those questions. And for me, I was never really sure. I went into nursing school convinced that I was going to do pediatrics, and then I thought about ICU. Finally, I've decided that the area that I want to specialize in is emergency medicine. My clinical this past semester has been in the ER emergency room, or some people call it the ED, emergency department, and I have fallen in love with the fast-paced action, critical thinking skills required, and the ability to stay calm in the midst of chaos. Ultimately, I'd like to become a flight nurse. Recently, I was talking to some of the doctors and nurses in the emergency room where I have my clinical, and they told me about something called the PHRN. I'd never heard of it before, and so I looked up more information about this. The PHRN stands for Pre-Hospital Registered Nurse, and it's a certification that can be obtained here in the state of Pennsylvania, but is recognized nationally in many other states. Today, I'm going to tell you a little bit about the background of the PHRN, what it is and what its requirements are, and what some of the benefits of having your PHRN can be. From NBC's new show Chicago Fire to classics such as Rescue 911, society has had a fascination with pre-hospital services. Pre-hospital care simply refers to care that's provided outside of a hospital, such as in an ambulance, on an airplane, or with Life Flight or Stat Medevac, the air ambulances. There are different levels of certification to be able to provide emergency medical services, from EMTs, emergency medical technicians, to paramedics. The PHRN is one of these certifications, but it's lesser known, so hopefully this speech helps you learn a little bit more about what it is. So first of all, what is the PHRN? Like I said, PHRN stands for Pre-Hospital Registered Nurse, and it's a certification that's recognized nationally. Here in the state of Pennsylvania, having your PHRN enables you as a registered nurse to provide pre-hospital care under the guidance of EMS Medical Command, instead of serving at a hospital under the direction of a doctor. The PHRN has evolved in response to a need for more qualified pre-hospital medical personnel. There's a need for skilled providers working in the field, and with increased technology and better transportation, it's imperative that care be delivered on the field so that patients have a better chance of survival once they reach the hospital. So what are the requirements to become a PHRN? In the state of Pennsylvania, you need to be a Pennsylvania registered nurse in good standing. You need to have your current basic life support healthcare provider CPR card. You also need to have taken ACLS, which stands for Advanced Cardiac Life Support. You need to be of 18 years of age or older, and you also need to successfully complete the National Registry written PHRN assessment test. In addition to that, you must also take the EMT or paramedic practical. So what are the pros of having your PHRN? As a PHRN, you can further use your skills in a foreign environment, which leads to career development and more education. It gives the nurse the ability to use his or her skills in a non-hospital environment without having to go through a paramedic training course. It's a career booster as it looks good on your resume and shows that you take initiative in your education. It provides training in an area that's often overlooked in traditional nursing practice. And if you're like me and want to become a flight nurse someday, having your PHRN is a requirement. Now, some of the cons of your PHRN, which to me aren't really cons, but just obstacles that need to be overcome, is that there is a stigma that exists separating nurses from EMTs and paramedics. Some people feel like because the training is different, or because paramedics don't have the degree that nurses have, that their roles are different. However, their roles are actually very, very similar, and it's important that nurses and paramedics, especially in the emergency room, be able to work together well to provide the best patient care. Each individual has their own sets of education and expertise, which, when brought to the table, can help lead to different perspectives that can improve patient care. Nurses are also at a slight disadvantage because they usually don't have the emergency medical services training that paramedics and EMTs do. However, if you're a nurse and are interested in emergency medicine, you can easily volunteer with a local ambulance service and get some pre-hospital experience before you take your PHRN exam. So today I've told you a little bit about the PHRN certification, why it appeals to me, why it's important to me for my career, and some of the pros and cons of having it. So hopefully now, whenever you see an ambulance service or a flight nurse, you'll know a little bit more about what goes into their preparation. Thanks for listening and have a great day.